Hi, my name is Mary Vukicevic and I'm going to explain to you how to modify the environment using non-optical strategies and lighting for your patient with low vision. So this textbook that I've referenced here, Scheiman, Whitaker, is a fantastic resource for low vision practitioners such as orthoptists, and much of the information contained in this presentation can actually be found in this reference. Whilst it's designed primarily to be a guide for occupational therapists, it contains very broad information that's useful for orthoptists as well. So, what makes a successful low vision rehabilitation intervention? Well, what you'll find is that sometimes patients don't respond to a low vision intervention as well as you expected. And this could actually be due to their vision, but it might also be due to psychosocial issues that we discussed in earlier topics in this subject. So I mean things like depression or coming to terms with sight loss, social support that the patient has in place, whether they have any home modifications, how independent they are, and so on. Now, studies have shown that in order to optimize a low vision intervention, you should actually start by educating the patient about their sight loss first. So talk to them about the physical cause of their vision impairment. So for example, if they have macular degeneration, explain to them that it's the macula, the central 10 degrees of their retina that's been affected, and then describe the functional impact of what that means. Well, you should know that the macula is responsible for fine detailed vision and color vision, and it's also the centermost part of vision. So the things that will be affected if a patient has macular degeneration are being able to read small print, recognizing faces, identifying colors, any of those tasks that are modified or that are modulated rather by the macula. So devising the appropriate treatment plan for your patient is crucial. Now, Watson, in her article, Functional Assessment of Low Vision for Activities of Daily Living, suggests a 7-step treatment plan where teaching new skills comes after patient education. So inform the patient about their eye disease first, then implement the new skills. So the importance of appropriate patient education has also been demonstrated for ophthalmic treatments. For example, in anti-VEGF therapy for neovascular AMD, it's known that providing patient education and support helps to improve their experience in terms of receiving that treatment. And it's much the same for low vision interventions as well. So, as I said, you start by educating the patient, telling them about their eye disease, the prognosis, what they can expect from the low vision intervention, and so on. You then need to move on to the therapeutic activities, and we already know about eccentric viewing training by now. There are other forms of vision training, including scanning training, help with reading, and so on. Next, you should modify the environment, so things like increasing size, improving contrast, manipulating color, using lighting, and avoiding glare are all very important. And I'll be talking to you more about those things, modifying the environment, in this particular presentation. There's also optical devices, which we already know about with our case study previously of Mr. Percy Fredericks, who needed a magnifying glass. There's computer-assisted technology, particularly for people that are still in the workforce and need that sort of intervention. But it's not just restricted to people in the workforce. Retirees and children in school can still use computer-assisted technologies. And then providing resources, and that means maybe giving the patient some handouts or notes or other information to take away with them after you've seen them.